Of course, there's already been a lot of discussion about the medical marijuana situation, but we do have a question that we wanted to ask regarding State 788. How will you handle the passage of State Question 788 in terms of employee liability?
We talked about 788 a little bit earlier, but not as far as this particular angle and employee liability. So, Mr. Drummond, we're going to start with you on that.
I employ over 500 in my several companies. We deal with employee and employer liability on a daily basis. And it is nothing different than somebody who has a prescription to use codone, for example. In our companies, if you're on a doctor-prescribed drug, then there's certain job functions that you can't fulfill. I think the same will be the case when medical marijuana is implemented across the state of Oklahoma. Employers will have to add to their human resource policies, and employees will have to be straightforward and self-reporting the fact that they're on a prescription for marijuana.
This is a really relevant issue, and Mr. Hunter will give you a chance to tell us your thoughts about that as well, employee liability.
So again, State Question 788 is a very progressive, a very flexible approach to providing medical marijuana to the citizens of the state. There are areas which are going to cause problems. This is one of those areas. But it's not up to me to determine policy with regard to what kind of liability is going to exist for employers when employees show up and they may have too much of the drug in their system. So where we are with regard to policy is there is a working group at the legislature. This is not appropriate for any kind of determination by the Health Department board. We've advised them as such. The working group is going to be dealing with these and other issues going into the next session, and I'm confident the leadership of that group is going to be responsive to the problems.